Infodemic management during COVID-19, Thailand experience. Infodemic during an epidemic. In epidemics, lack of knowledge about the situation often causes an onset of panic and fear amongst people. This is especially the case with the COVID-19 pandemic, as it is a novel disease and its causes, prevention methods, and treatments are not well understood. This results in excessive information that society cannot differentiate into truth or false, also known as an infodemic. The World Health Organization coined this term during this pandemic. The infodemic is now considered a global health issue and an important factor affecting the prevention and control of COVID-19 and other epidemics. Data collected in Thailand found that the high number of infections during the first phase of the outbreak coincided with increased spread of misinformation. What are the consequences of sharing this information forward? Some of the information may seem harmless, but because they are not backed by academic or scientific evidence, following some of the recommendations we see in forwarded information can be detrimental to health. In the very worst case, forwarding misinformation in large droves can trigger panic and hatred in society, and result in reduced confidence in COVID-19 prevention and control measures. A survey conducted by the International Health Policy Program Thailand, IHPP, found that misinformation can be spread on a wide scale. 82% of survey respondents had encountered misinformation on social media in the past month. The survey also found that up to half of the respondents could not distinguish facts from false information, 54%, especially scientific information. However, most of them avoided forwarding the misinformation, 87%. How Thailand responds to these issues. Thailand is dealing with the infodemic in accordance with the Risk Communication and Community Engagement (RCCE) framework, which has the following guiding principles: being nationally led by governments, integration and harmonization with public health, coordination across technical specialties, following a community-centered approach, ensuring community participation, having inclusivity, using open and transparent communication, being informed by data, maintaining accountability, building trust. On the principles of being nationally led by governments, integrated with public health, and coordinated across technical specialties, the Center for COVID-19 Situation Administration, CCSA, composed of representatives from every ministry, acts as the focal point for information dissemination. A CCSA spokesperson provides national daily reports, including to government organizations, mass media networks, communities, and the public. On the principles of having open and transparent communication, being informed by data, being accountable, and building trust, information is disseminated through various channels in accordance with the missions and responsibilities of each government department. In addition to Thai, information is also communicated in English, Burmese, and Khmer. On the principles of having a community-centered approach, community participation and inclusivity, community center leaders and village health volunteers, VHVs, visit communities to directly engage with and provide information to members. Based on Thailand's experience, these are our recommendations in dealing with the infodemic. Cooperate with the international agencies in building global partnerships to strengthen fact-checking systems. Strengthen cooperation at the national level by involving different sectors to disseminate credible information and counter misinformation. Increase public trust and confidence by monitoring and evaluating social awareness and making information easily digestible. Every individual can play a part in limiting the infodemic by verifying the source of information they receive and not forwarding information that lacks evidence.